Good evening, everyone. Let us discuss this very important question. The question reads, true about non-diabetic glomerular pathology in a patient of diabetes, right? So we all know that diabetes patients, they are predisposed to chronic kidney disease, right? And we call this CKD as diabetic nephropathy often. And if you recall, it is a glomerular pathology. What is the pathology here? The most common pathology here is diffuse glomerulosclerosis, right? Okay. Now the question says that true about non-diabetic glomerular pathology in a patient of diabetes mellitus. See, often in a patient of diabetes, we find diabetic nephropathy only, but then it is a clinical possibility that diabetic patients may have some non-diabetic glomerular involvement, right? So when will you say that in this diabetic patient we have a non-diabetic glomerular involvement? So the option A says presence of significant proteinuria along with hematuria and RBC and WBC casts on urinalysis. So we have this finding in diabetic nephropathy, or do we have this finding in some other glomerular pathology? Like diabetic nephropathy, there is no inflammation as such, right? It is just characterized by diffuse glomerulosclerosis. So if you recall the previous discussion, we discussed that, because of this glomerulosclerosis, there is loss of the normal architecture, there is dilution of the negative electrostatic charge because now there is sclerosis in the glomerular basement membrane. So type 4 collagen is relatively more and the heparan sulfate molecules are relatively less. So we have loss of the negative electrostatic charge and therefore albuminuria is the issue in a diabetic nephropathy patient. Right, so we do not have any hematuria and cast formation there. Hematuria and cast formation is suggestive of a nephritic pathology. Nephritic pathology means is indicative of some inflammation into the glomerulus. So as I said, in diabetic patients, we do not have any inflammation as such in the glomerulus. Then the option B writes rapidly declining kidney function. Well, diabetic nephropathy, again, we have already talked about, is a long-standing issue. If you recall, we have discussed already that end-stage renal disease happens to a diabetic nephropathy patient, after many, many years. If you recall, exactly after 25 years after uncontrolled diabetes, these patients, they go into end-stage renal disease in the background of diabetic nephropathy. So diabetic nephropathy is a slowly progressive condition. So if it is a rapidly declining kidney function in a diabetic patient, you need to think of some other kidney pathology. And lastly, the choice C says absence of diabetic retinopathy. Well, again, these microvascular complications, they, typically develop, if you recall, after 5 years of diagnosis of type 1, though we need to screen them at the time of diagnosis in a type 2 diabetic patient for the reason we have already talked about. So, but if you recall, we discussed that among these two microvascular complications, retinopathy and nephropathy, the retinopathy develops first, right? And then nephropathy. So if there is absence of diabetic retinopathy, it is a point against diabetic nephropathy as the cause of, pathology in a patient of diabetes mellitus. So answer to this question is all the above, right? So if we have, besides proteinuria, other findings on urine analysis like hematuria, cast formation, we need to think of other kidney pathology. Similarly, if it's a rapidly declining kidney function, right? So again, you need to think of some other kidney pathology, and absence of diabetic retinopathy is a point against diabetic nephropathy. So diabetic nephropathy, we will be, thinking of, which is the usual scenario, obviously, in a diabetic patient. only when we find, in the urine analysis, albuminuria as the only finding, right? And as I said, it is a slow progressive conditions. There will be a long history of uncontrolled diabetes mellitus into the patient, and proliferative diabetic retinopathy changes are usually there, right? So take a very good care of yourself, in this pandemic which is going on, and do go through this ENT for entrance exams. Thanks.